I think we agree. And as a small business, I look at it frequently. Do we need healthcare reform, redoing our whole healthcare system, or do we need healthcare insurance reform, where maybe getting insurance across state lines, maybe having redoing the Medicare payment schedule, where maybe the government would pay a certain amount for Medicare, and then you and the patient can decide on what fees are appropriate, rather than someone telling us this is what we must take.
So I think one of the confusions about this debate is that people confuse the issue of the supply and demand of healthcare with the issue of how we finance healthcare. Those are really two separate issues, okay? In terms of the supply and demand for healthcare, the core problem in America is that over 80% of the healthcare is consumed by people who don't pay for it. In other words, it's the insurer, the government, or your employer that pay for your health care. You don't have skin in the game. A much better plan would be to empower individuals to control their own health care dollars through tax deductions, not through the employers, but which they get themselves, which makes them a smart shopper for health care, so that we wouldn't consume without any sense for what it is we're buying.
Totally agree.
So the second issue is how we finance health care, okay? Insurance, in its purest form, is supposed to be for that large expense that you can't pay for yourself. We've changed insurance in America to the concept of first dollar coverage. A much better plan would be the one reform, the one innovation in healthcare financing that really works is health savings accounts. Create a tax-deductible, tax-deferred personal savings account that people could start at a very young age to build up a bank of dollars, almost like a checking account, to pay for their ordinary expenses. They would own it. The government wouldn't own it. It would create tremendous individual security, especially as people age. The other thing, over multiple generations, it would create trillions of dollars of investable capital, which could funnel into the economy to finance businesses. You combine that with a much more dynamic, flexible, multi-state insurance business where people could buy the insurance policy they want, not the one dictated by the government, but the plan that they want. It would typically be a higher deductible plan where they would have more skin in the game. They would pay for the ordinary expenses through their HSA. That way we would have smart financing, smart consumption, and we would have fair reimbursement for the providers of healthcare who need to run a business.